those things wey fit make person get back pain?
Okay, there are some risk factors when fit make people get back pain.
Wetin dey my screen right now, this thing wey dey my screen, na say every human being wey dey lis ten to me, this be like your back. Wetin I wan show you be say, look at this picture here. You see this bone? This is your spine. That bone wey dey for the back, from your neck down to the region of your waist. This is the bone. Now, this bone dey very important. E dey help you fit stand like human being, fit waka. E dey protect you, give you support. Now, for this bone, we get muscles. Can you see the muscles around? You see this one wey dey for the shoulder here? Can you see the muscles? They work together. Now, you see the muscles there. You see the bone, abi? Very good. Inside the bone, around the bone, you get wetin we dey call ligaments. So I wan open another picture again. Make I show you now. Ligaments. Wetin be ligaments? Ligaments na things wey dey join your bone for the back to another bone. Showing you all what we call ligaments. You look very carefully on my screen right now. You see these things. You see these bones. These are like the bones in your back. You see these things here, the bone. Then we get ligaments. Ligaments, they join each bone to one another. You see them? They join bone to another, one bone to another. Now, for this bone where they up and this bone where they down, if you look in between, there is something there. If you look in between the bone above and the bone below, there is something in between. See, I'm here. It there for everybody back. Those things, we they call them intervertebral disc. It be like shock absorber. So when one bone they up and that bone they shock absorber they in between, intervertebral disc. Now for this bone too, you still get what they call nerve. Now we get shock absorbers. These things are very important, meaning that if you get back pain from the bone, see these bones, you can have back pain from your bone. You can have back pain from your muscle. You can have back pain from those shock absorbers if they come out for where they're supposed to. If you get back pain from the nerve, you they follow me at all, or you know they follow. May I know whether we did together? I'm taking my time to break this down because this topic is very important to almost everybody. So then I will show you about the nerves. Now the nerve they carry information from all your body, go your brain back to your spinal cord. If you get problem for the bone, you get problem for the muscle, you get problem for the intervertebral disc, the shock absorbers, or you get problem for the nerve, or you get problem for the ligaments where they join one bone together, you fit get back pain. It makes sense. Very good. Right now, when we go to the risk factors, wetin be those things wey fit make person get back pain?
Okay, there are some risk factors when fit make people get back pain. I know Dr. Fred don't talk so many things about the back itself and some other things. So I go just talk some, give us some risk factors, and so that we can actually continue. And one of the risk factor is age. As people grow older, they are more likely to get back pain. So within the age of from 30 to 40, as they go, back pain, they fit get back pain. Now, people where not they do exercise most of the time, and that is lack of exercise. These people are still also the physical get back pain because this time they know they exercise the muscles of the back, and sometimes the muscle fit on they stiffen, and that will feel lead to back pain as well. People with excessive weight, people will get weight too much. And they talk about those where they fat that are obese. Those people will get too many weight. When they say their bone, their spinal cord and even their hip bone, not the fit carry them well. All those people physically get back pain. Diseases, some diseases physically cause um, back pain. Example like arthritis, some cancers, mostly for men, prostate cancer fit affect the low back. Eh? For women, when they some of them when they get infections, some of them say they get low back pain. However, arthritis mainly and cancer, they contribute well. to low back pain, and those ones they affect the bones in particular. Improper lifting of objects. And when you they lift a lot of objects, and some people physically get back pain. Improper positioning when you they sleep, your bed, when you they sleep, when you see some people for their bed, as they lie down for their bed, they'll be like say they enter inside the bed. And so that's improper positioning during sleeping and all that. All those are physical cause back pain. Psychological condition, physical back pain, depression, anxiety, all those ones, they fit get back pain. Sometimes the pain fit not dey there, but their mind go just dey think say they get pain. And also maybe they can also, because of their depression, they may not want to do some exercise, they may not want to do anything. So it will lead to tension. And so the muscle will dey tense, and that can also lead to back pain. Also, smoking can also lead to back pain. It dey increase the rate of back pain. And because through smoking, people can get problem to their bones, thereby leading to high risks of osteoporosis. Eh? Weakness of the bone will fit come to play during smoking. So these are some of the risk factors when go fit make people get back pain.